question about heart murmurs, and do we need them to be evaluated in all patients? Specifically, it depends if you're an adult or a child. Many times in children, there's a benign heart murmur that exists. Your pediatrician will recognize that and monitor it and follow it closely, and there's not much to worry about. It's just flow across one of the heart valves. As you get older into adulthood, heart murmurs do need to be evaluated, at least by your primary care doctor, and a referral to a cardiologist. A cardiologist will perform an echocardiogram, which is an ultrasound to help us understand and define what's the cause of the heart murmur. And if something needs to be done either surgically or with a catheter or with medications, it's better to identify that early on prior to compromising your heart.